Hello, my name is Aubrie Hargenrader McEwen, and I am from Youngstown State University Honors College, and the title of my project is Deafening Silence: Injustice in Deaf Education. So as a quick overview, the goal is for us as individuals, as a society, and as learning institutions to reach equality at every level of education and subsequent outcomes from that education for the deaf community. And I listed some of the levels I'm going to be discussing in this presentation. So the first level is preschooling, and I don't mean preschool the place, I mean before you actually go to elementary school or primary school. And so some quick statistics are that 3 out of every 1,000 children in the United States are born deaf or hard of hearing. 90% of these babies are born to hearing parents, which indicates that it is not a hereditary trait in most cases. And 95% of newborn babies are screened for hearing before they leave the hospital. However, that does not always catch it. So early detection really is the key. Usually parents are the first level of detection, and then they would take their child to a primary care physician, and then their PCP would usually refer them to an audiologist. And I really quickly wanted to mention that there is a shortage of audiologists. It's a growing, expanding field, and they do need more of them in order to provide adequate care to deaf individuals. So I wanted to touch on cochlear implants because I think they're very, very important when talking about equality for deaf students, because roughly 40% of children who are born profoundly deaf now receive a cochlear implant. That's a 25 increase from 5 years ago, largely due to pushing from Department of Health and Human Services. They made a 2010 Healthy People goal to have a certain amount. That amount was shattered. They went way above. And so they have raised the Healthy People 2020 goal to get more people, more children, to get these cochlear implants. And a cochlear implant, the difference between that and a hearing aid goes right in your ear, sort of like an earbud, and it amplifies sound, whereas a cochlear implant, it goes directly into your head. You could get one on either side or both sides, and it directly stimulates the auditory nerve, which can destroy residual hearing. Now, it's important to mention that in their report, they even admitted it only can increase the perception of sound, so not necessarily normal hearing. And there are a lot of problems with cochlear implants because there are very many limits for technology. If there's a battery problem and it dies, there's no residual hearing to fall back on. If it gets too wet and it malfunctions, there's no residual hearing to go back on. So it's really important that people are well informed before they decide this, because if something were to happen, their child might be left with no hearing whatsoever. And speech is still heavily limited. There's only so much that stimulating the nerve can do if the nerve is damaged, or any other means for having deafness. So one quote that really stuck with me was that my sign language instructor in college said that every adult that she knows that was given a cochlear implant as a child does not use it now at all. And she was heavily involved in the deaf community. So she was just trying to let us know that these aren't really the best solution for them. So the first step is deaf education. Despite the large number, or semi-large number, depending on your perception, of primary education schools in the United States, more than 75% of deaf students are mainstreamed into public school. And that can be done in one of two ways: either a deaf education classroom, which is similar to a special needs classroom, or a one in a crowd scenario where you put them in literally with all the other students and you give them an interpreter or whatever they need to try and make it happen in that regular classroom. So of the students who went in through primary education, 75% of deaf students enrolled in secondary education. And of the United States population, you can see from the graph below that 18.7% of the hearing population doesn't graduate from high school, whereas 44% of the profound hearing loss population do not graduate. So another quote from a student who was profoundly deaf in my sign language course, who was never given sign language instruction until college, said it was really hard. Being mainstreamed was definitely hard. My friends would sometimes joke that I was slow, and that kind of broke my heart, because even his friends, he was still one in a crowd. They didn't understand, they weren't going through the same thing, and high schoolers can sometimes be kind of cruel. So there is some conflict surrounding American Sign Language. I don't have time to read over these quotes, but the first one was a letter to the editor to the New York Times. And it was a parent of a deaf child saying that he thought that sign language can sometimes be self-imposed isolation. It separates you from other people. Whereas the bottom quote was from the National Association of the Deaf, and it says that the benefits of acquiring and developing proficiency in both ASL and English is something that they're dedicated to informing parents about. And so the bottom line is that American Sign Language is highly beneficial to language development. A study was done with pre-kindergarten children who are hearing, who received sign instruction, and they achieved significantly higher on the Peabody Picture Vocabulary Test than students who did not receive such instruction. And the conclusion for the researchers was that simultaneously presenting these words visually and kinetically was very beneficial to them. So here we're talking about tertiary education. So if a deaf student who graduated high school would like to go to college, they have a couple of options. They could go to Gallaudet University, which is the first and only all-deaf U.S. college in the United States. So the acceptance rate is 66%. So if they either don't apply to Gallaudet or they didn't get in, they could go to a normal college where they would have to go through disability services, get accommodations. They could try to join organizations to increase their feeling of culture or belongingness. But overall, 12.8% of the hearing population goes on to graduate college, whereas only 5.1% of the deaf or hard of hearing population graduate. If these students don't attend college, then they would go through and try to enter the workforce. So really the most important takeaway from this presentation, I hope, is how we can all help. So legislation is extremely important. The reauthorization of the Early Hearing Detection Intervention Act is specifically a big thing for the deaf community. It mandates that all babies are screened by the age of 1 month. By 3 months, they identify if they're deaf or hard of hearing. And by 6 months, that family is enrolled in the appropriate support groups that they need and intervention programs. Raising awareness is really important. So you can do that yourself or as a group or a club on campus. I'm the president of the Sign Language Club, so we try to do this sort of stuff. We read Deaf Like Me by Thomas Bradley. You could watch In the Land of the Deaf, which is a documentary about the deaf schools and oral schools, how they used to be. You could take a sign language course. You can go visit your deaf community center and involve yourself in their different events. Or you could just offer support. So that's more of an institutional thing that we need to try to do. Is the social model of disability states that disability isn't a quality of a person, it's a quality of a relationship between a person and their society. Basically saying that if you give someone the tools they need to succeed, they are not unable or disabled for anything. So someone in a wheelchair isn't disabled unless you don't put a ramp on your building. So that's just kind of an example. So overall, my own personal most important points here are to reduce cultural isolation, increase awareness, provide adequate funding, and support the deaf community, give these students what they need to bring those numbers up to equal amounts for hearing and deaf individuals. So these are my references. They're in order of appearance. And I also had an additional slide about employment, but due to time constraints, I had to take it out, but you can review that if you'd like. And if you had any questions, concerns, inquiries, or interests in any of the information I presented in this presentation, you can feel free to contact me and my email is there. So thank you very much for your time, and bye.